Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. So, hello, how are you? How's everything going?
Hi, Bhavna. I'm good. So I just had like a very relaxed Sunday here. It's Sunday evening here in India. And yeah, how have you
Good.
been?
Good. It's Sunday morning here, just early morning at 8. And I'm about to start my Sunday. This is my session for today. And then I'm hoping to have a very relaxing and healthy Sunday myself today. So that's the plan.
Yeah,
So let's dive in. I'm so happy and excited to have you here today. Thank you
thank
so
you.
much
Thank
for
you so
being so
much.
supportive and so enthusiastic at the same time to come talk to me about health on this platform. Let's talk about health by Bhavna. And without wasting any time, let's just dive in. Let's get started with my favorite question. What is health and what, according to you, is fitness?
Um, so health, when you really look at it, it's everything to do with your physical, mental, and emotional well-being.
Right.
Health really gives us the status, and fitness means we are doing pretty good at all of these three levels, physically, mentally, and emotionally. A lot of times in modern medicine, we have a lot of focus towards just one aspect of health, physical. So we only consider, okay, if it's a knee pain, we try to take it down with a few muscle relaxants, maybe some exercises, maybe some physical therapy, electrotherapy techniques, or manual therapy. And we never really think about the mental or emotional aspect of it. Um, and I think these things are very underrated and they're so important when we are looking at improving a client's health completely. So I would say that I've always looked at it from all of these three perspectives. They don't just affect a regular person who has come in with pain, they also affect an athlete's performance. Basic things like sleep or poor mental health can affect it. And it can also affect their pain. And given my profession, I have worked with athletes and regular people with pain the same way. And the way that I have approached basic assessment, uh, history taking, my history taking is twice as long now, is just to be able to understand where the client is coming from physically, mentally, and emotionally. And I'm also always trying to get them to a point of fitness in all these three, where they are able to identify and work on each one of them, which is why I also require a lot of reference to other doctors in case if they, need it for their overall fitness. Yeah.
Definitely. That's a perfect way to work in and around the community. Like you're
Correct.
helping a person to your maximum capability, but you're also open to refer them to experts that are experts in their own field. And I love and appreciate that about you. That
Thank
was
you.
that was really awesome. Like everything that you said, and I agree with you 100%. So how do you approach fitness?
So, my industry being more related to physical fitness,
Mhm.
I usually see fitness as a way of life.
Right.
I was just having this conversation with a friend today as how one of the major barriers that we have is people don't realize that fitness is a way of life, that they can get cured with just the help of physical exercises and not any other medication or treatment. And I have been fighting. So I am a certified manual therapist. That's what I studied when I finished my master's as well. And over the past 12 years that I've been in the industry after my master's, my perspective around the entire thing has changed. And I've started to study so much more about strength and conditioning. And I've realized that physical therapy is about physically being able to get them back to normal, which requires a lot of physical training from the client side because passive trainings don't work. They may work for a little while, short duration, to bring down the intensity of pain, but ultimately to get the client back to their daily activities, it's so important for me as a physical therapist, not just to know beyond my basic, bed exercises, which a lot of us have been taught during our medical school, but to learn above and beyond that, go into different fortes like learn from a strength and conditioning coach, read on your own, go study up the evidence, the articles on a regular basis. So for me, getting my client techno fitness has been all about me, trying to understand how I can make physiotherapy work for them. And this is what I've learned. Get them into strength and conditioning, get them into strength training. That is the ultimate goal because you don't want somebody to come back to you year after year as a client. You need to show them the way so that they, number one, understand how important it is to stay fit. And number two, they have the tools that they need to be able to do the job. I think that's where a lot of doctors lack, where we show them something that will work just for the time being, just for the next few months. We show them rehab. And after that, they have no guidance. They do not know what to do. They fall into old patterns. There is no long term learning which is happening. And first, they don't have a relationship with fitness. They feel like exercising is punishment, so they never end up doing it after their pain is better.
Yes.
And it it just needs to be part of their life. So from day one to I think like what day 615, I've had this conversation with my clients, and like not like they have been in rehab with me. Like I take them into strength and conditioning, and I usually always tell them like movement is medicine. You want to stay healthy, you need to keep doing this, just like brushing and bathing. You don't brush when you have tooth pain. You brush every single day.
Right. You were mentioning about that. That reminds me, very recently, one of my patients here told me the full form of PT. I'm like, yeah, whoa, what do you mean by PT, physical therapy? She's like, no, PT is pain and torture. So I love that, and I have been waiting to get that on a T-shirt and just show it to her. I love that she said that, but the fact that she said afterwards that, you know what, actually you making me do so much strength training has helped my shoulder get the ranges back, and not just that, I'm able to breathe better because we're working on chest. My shoulders and my scapula is doing better. Like I don't have any more, not just shoulder, I don't have any more neck, chest, or upper back pain. So that's a huge thing. That's what we're targeting. We're not just like you said, you look at a person as a human as a whole. You don't just look at just the physical aspect of that patient. Oh, it's just shoulders,
Exactly.
let me just give them a few pendular exercises and call it a day. No, that's not how PT works. So I was when you were mentioning that, that story came to my mind, and I've been waiting to put that somewhere, and we're gonna print it out, and we have a wall with all the pictures of our patients and all the kids that we have now. So we're just gonna, we were thinking to put it on that wall. It's very funny when you think about it.
No, I completely get that because a lot of my clients as well thought the same until I moved over to telehealth, and
Yeah.
there has been a huge change in the way my clients perceive me and they perceive their therapy. And they've had a very positive relationship with their recovery rather than, oh, I've just come to PT and they're going to give me a lot of pain. So that's kind of gone down a bit in telehealth, though.
Since you touched the topic of telehealth, let me ask you your opinion and intake on telehealth.
So I think telehealth, a lot of people dismiss it
Mm-hmm.
as something that came about during COVID.
Mm-hmm.
So when I was taking care of this clinic in Chennai, we used to have a lot of clients who were just visiting. They were NRIs, and we would get them better. We used to have like maybe a week to 10 days course to reduce their pain, maybe from a 8 on 10 to a 2 on 10 and get them started on rehab. But we often found these clients would go back to wherever they came from and they would not get better. So my first experience with telehealth was maybe in 2016 or 2017 when I was taking care of a few overseas clients and they were continuing their rehab through us. And I found that this was amazing because, clients could never recover 100% because they were kind of like left alone after a certain point and they did not know where to go forward from there. So I have been exposed to telehealth since then. It's true that I only had one or two clients. Then during COVID, I mean, it was just a day's notice. We were shut down and we had to shift all of our center clients online. And we only had 2 to 3 physiotherapists who had like a laptop and internet and everything. And then overnight, we came with solutions. And I remember taking care of 8 clients online in a day, 8 to 10 clients, I think. And that's when it was initially, of course, it was hard because there is a certain period where the client is also getting adjusted to it. They're not able to understand. And then I realized that you can actually teach them how to be able to do basic manual therapy. Now, we do need to understand that there are very specific techniques that only physical therapists can do. But you don't need specific techniques for each and every individual patient that comes to you. Secondly, it's more about being able to help every client rather than giving the absolute perfect treatment to only maybe 5% of them. Sometimes you need to pick and choose your priorities. I realized during COVID that clients were listening to me. So they were getting a lot of education about their body, their health. They were starting to build a very positive relationship with exercise because I was not physically touching or giving them any pain or torture, as you suggested. It was all them motivated, working towards their pain and taking active responsibility towards their improvement. I think the active responsibility that is very important because if they don't realize that they are responsible, then they are just going to the clinic and they are getting passive treatments done. It was very hard for me to move online, and I virtually work like exclusively for the past 3.5, 4 years, especially since COVID hit. And what I've learned is if the client understands that, no, it is my responsibility, I have to get my body back to normal, they would do it. Next most amazing thing was the consistency because the best treatment is going to work if the client takes the treatment. If they come to you and you give them, the best possible advice, and then they are not able to come back to you, it's really not going to help them. And we have clients everywhere. People are like, even in the US, even in India, people are living in the suburbs, people are living in tier 2 cities where they do not have access to physical therapists. Forget that. Like, they may not even be able to drive to a hospital. A hospital is not close by. But because of the internet, everybody is working from home. A lot of people are. So, how do we improve the access to healthcare? Uh, Another great thing is like imagine just taking out 45 minutes of your day just doing your session and that's it. You are free. You don't have to travel to a center. You don't have to come back from a center. You can work out of your home gym. I have a lot of clients working out of their home gym, and they have access to all of the weights and the equipments, and I'm able to help them online. And the how easy it is on their pockets as well, because if you are not traveling to and fro like home visits, we travel to the client, then we do the treatment, then we travel back, it would take double or triple the time, and again double or triple the money. And this way we are able to cut costs. We are able to become more efficient, and we are able to give consistent treatment wherever the client is. I think this is revolutionary what has happened. I never thought as a physical therapist we would ever be able to work from home. I have had some amazing success stories of people who gained a lot of self-confidence with what they could do during the session, and they've almost all of them have recovered from their injuries, which is amazing. I've not even seen this, on one-on-one sessions.
Yeah, that's awesome. Like, I love the fact that you mentioned the reality. We all do the sweet talking, but then, and it was a mindset. I agree with you. It's physical therapy, so you have to
Correct.
physically doing it. I
Yeah.
thought that as a therapist too. but I have had not a lot of clients here, but I did telehealth for a few. The sessions here, the insurances work different, so the further sessions cannot be conducted.
Mm.
But I was exposed to that fact of telehealth, and I did see that the patients have to be motivated, and they are. There are people out there. You just need to find the right crowd who are motivated and who want to work with you, with your background and your years of experience. And now that you're working in telehealth for 3.5 to 4 years, that's an achievement, and you can confidently have, like, if right now if I start clients, I'll be blacked out too. Like, I'll be like, okay, what protocol will he be able to do it? What should he have around the house? What can he buy? Should he be spending money? All of that. So you are in the field, you've been working, and that's awesome that you have had your own set of protocols now, and your clients are doing so amazing. It's remarkable to see that. My question here is, we were talking about consistency. How do you keep them motivated, and how do you keep them going to be regular for their sessions?
Um, so first of all, I would also like to take help of evidence here, because it's not just that some people are doing telemedicine out of nothing. There's umpteen evidence to support that the assessment is almost similar to doing a physical assessment in person, the assessment done online. So when I start with a client online, it's very similar to what you would do one-on-one. So there is an appointment. I take all of their medical data ahead so that I'm prepped. We do a complete history taking where we understand 50% of the diagnosis happens during history taking itself, if you do a good one. And then you do a physical assessment. And yes, there are many components of physical assessment, but everything need not be done. Now, these are ways through which you build confidence in the client. Of course, nobody will be willing to directly go on, online sessions. So usually what I tell them is, why don't you do an assessment with me? Okay, that will just be one session. After that, if you're not very comfortable with the way I work, you're free to go and meet another physical therapist, because it's really about, if the patient trusts you, then their treatment is going to work. Otherwise, the best treatment in the world is not going to work for them. So when I do an assessment, I also tell them that once we have planned out, like, whether we need to do I teach them how to be able to do a myofascial trigger release therapy at home with the help of a release ball or a foam roller, depending on how comfortable they are, or with another person's help, like their family members' help, or by themselves. So I teach them all of these techniques. And then when they start to see that the pain is coming down over a period of time, and they are actively doing it, and I'm not touching them and I'm not doing anything, that's when we build confidence in the client that they're getting better. It motivates them. Number two, I always plan follow-up
Right.
assessments. And as well as I take a lot of questionnaires from these clients, like I use an ODI to check for the lower back pain. I use the quality of life questionnaire. And then they start to see that their scores have improved. Okay, so we do a physical, like an online physical assessment to check whether all of their problem areas have been improved, as well as we check their daily life, like the quality of life questionnaire, whether all of the functional activities that they were finding difficulty in, whether that has improved. So I think this is a great way to keep the client motivated, because the client doesn't just want the pain to go down, they also want other things in their life to improve, as well as constantly helping them understand that it's not just about the pain, it's also about, with the same amount of pain, you are able to do 100 times better than before. Like, you're able to carry your child, you're able to drive, you're able to go grocery shopping. And previously, you were just like bedridden with a lot of pain. So it's also about showing them that there are different aspects of life, and the pain may not completely go to zero. So there's a lot of counseling that happens. I never tell my client, unless there is a situation like this, that, do all of these exercises at home. These are the exercises, because I think that's a huge drawback in our system. The client will never be able to understand and do the exercise the way we intend them to do. So following up, constant counseling, them seeing improvements, and giving them objective things, on a scale of 0 to 10. What is your NPRS? What was your NPRS on day 1? We write it down. What is your NPRS on day 6? And I document these things. And I tell them, you remember your NPRS on day 1 was 7. And now, even though you're complaining of pain, your NPRS come down to a 5 and you're able to do a squat easily. So these are objective things that when they see numbers, everybody loves numbers. So I think you also need to keep them engaged with, okay, your scoring was really bad in a quality of life questionnaire, and now your scoring has improved. So you are able to do more things. So I think all of these things keep the client motivated.
Yeah, definitely. It seems like work,
Yeah,
but it seems like good work that will help push the client in the right direction. Yeah,
correct.
definitely. I love the fact that you're so technical about this as well, and not just like, oh, okay, let's just have the sessions planned out. We'll see how it works. You're really putting your heart and soul in this work, and that shows. That really shows.
Thank you.
So let's move on to the next aspect that you were mentioning that you've been working with a lot of athletes and a lot of sports players. How do you what kind of sports injury do you come across and what do you do to tackle them?
So the most commonly seen injuries, right now, currently, I've been working with a lot of runners who are practicing for like for very long distance running, like ultra marathons, and even like beginners who are getting into running.
Mm-hmm.
And the most common lower limb injuries that I see is chronic ankle instability. A lot of them is because of mismanagement that happened at the ankle, of any ankle sprain that they had previously in the past. And they were not completely rehabbed from it. Usually, these clients will have a history of recurrent ankle sprains, and they would have had at least about 3, 4 in the past. The problem is that they only rehab for that time being. And secondly, they are completely put into bed rest, which is horrible because, at least, especially for an athlete, because the more time that they have in bed, that means that it's leading to a disuse of muscle and muscle atrophy. Okay. And you're also losing neural connections of, learning the movement. So it takes even longer for them to get back. So until then, they have already forgotten how to do the activity again. We've already lost precious time of, like the neurons getting activated again with the help of balance training, agility training, all of that. So I see chronic ankle instability a lot, and it usually takes a very, very long period of time. I've had to work with athletes for 1.5, 2 years to be able to, and it doesn't mean that they were doing the same exercise for 1.5, 2 years. They were on field and they were complaining, for example, they were complaining after running about 10, 15 kilometers for ankle pain and foot pain. So I've had clients like that, and I never stop their game until they are in a lot of pain. So I tell them, keep doing whatever you're doing. It's important that during your competitive phase, you will understand where your pain is, and I'll have to fix it during that phase. So if you're in bed, of course, you're not going to have any difficulty. So I never stop rehab, and I never stop their sport. So if you're playing cricket, you're playing badminton, please continue playing it. If you have a terrible injury, you can stop, or you have terrible pain. This is another way that I guide my clients, that on a scale of 0 to 10, so I take them as, like red light, orange light, and green light. So green light is 0 to 3, green light. You can exercise over 0 to 3 pain, no problem. Okay, so 4 to 6 is orange. You need to check what you're doing. Maybe stop, don't do that. And red is like anything above 7 pain, please stop playing, please stop running. So I always follow this. I have not come up with this. I've heard this somewhere and I have seen it work great. So I'm not taking any credit for this system, but I've seen that it works great for my clients. So chronic ankle instability is one. Second is IT band pain. A lot of runners, I've seen that. And usually it does not even stem from the IT band. It stems from poor mechanics at the hip, at the pelvis. A lot of them have extremely weak pelvic floor musculature. So I start with training there. I start with an assessment initially, of course, and I either add a running gait analysis or a walking gait analysis too as part of my assessment so that I can understand how they're doing.
Right.
So along with this, a lot of back pain. And back pain, usually I've seen a very strong correlation to lower limb muscle strength not being enough,
Right.
which is why the back has to overwork. People keep saying like core stability is not there, but you know what? Like it's not really about the core stability. If your legs cannot perform after a certain point of time, your back is going to get injured. And I see this a lot in athletes because, of course, like, you know, they can do a plank for 2 minutes. Like it's not a big deal for them. They have good core strength, but it's the legs which are not able to do the job. So, of course, the other muscular systems are taking over and they are getting pain. So overwork can also give pain, and I think this is something that people need to understand, like overwork being done by the back. So that's, and for shoulder, I've seen a lot of rotator cuff injuries, a lot of it. And again, rehab is usually not completely done. So you see people just working with bands for a very long period of time, which I think is, you know, like again, detraining the muscle. It's not loading the muscle enough. We need to move fast, quick, move out of bands within probably the first week to 10 days of injury and move them onto weights, move them into functional activities, move them into body weight activities, stabilizing the shoulder, working on the scapular muscles. All of that is very important. And ultimately, plyometrics for the arm, which is very unheard of. People usually end up doing it for the legs. It's not done enough for the arms and upper body. So moving them to that is very important. So these are, in short, the common injuries that I see.
Yeah, I like the fact that you mentioned the rehab takes usually 1.5 years. It's not that they're not recovered, but they still need PT.
Correct.
People need to understand that rehab is really a long process. You may get injured on the field at that moment, but it also comes from weakness that is built from years of not proper strength training or incorrect posture or so many other things. And they want quick recovery. Oh, like 1 week or 2 weeks, just fix me up. That's not how it
Correct.
works. That's
Correct.
another patient education that I'm learning. I'm learning more to do more of that counseling where I'm explaining, hey, like the recovery, the rehab is a patient process. Like
Correct.
you have to be patient about it. It takes a longer time than you're expecting. It's definitely magic and miracles, but it takes longer for that.
Yeah.
So, yeah.
What
What do you think?
I usually, sorry, sorry for interrupting, but what I usually tell my clients is that, you know, the injury usually doesn't happen in a day.
Yeah,
So it will not go away in a day. It's been a while that you've had this pain, maybe, you know, sort of a pull, which you kind of neglected. So if it's been there, if your pain, if your injury has been there for many, many years, it's only logical that it's going to take a few years for it to completely go away.
definitely. Makes 100% sense. I was gonna ask you, what do you think about prehab? Like, if a patient is doing good and the injury that they had is completely recovered, but they still need the prehab. Or I have come across patients where before surgery they are with me. So we get them strong enough and then they opt for surgery afterwards. So what's your intake on prehab?
So prehab, again, it works on the model that dentists work on, you know, where we don't go to a dentist when we already have tooth pain. I mean, some of us do, but mostly going to a dentist is part of our regular routine checkups. We've also started to do regular health checkups. We don't wait for a heart attack anymore, right? We are doing it since we are like in our 30s, 30, from 35 onwards, we'll start doing our you know, regular ECGs and echo and all of that. So all of this is preventive medicine because we all know that prevention is better than cure. But rehabilitation has been the only thing where we wait for the injury to happen and then we go ahead with treatment. It's actually very counterproductive. It's not a very efficient system, and this is when you will end up spending, you know, like thousands of dollars probably in your treatment over a period of time, which is where rehab comes in, which is preventive rehabilitation,
Yeah.
which is where you go and meet your physical therapist, you do not have pain, or maybe you have a very mild one or two pain. Maybe you have a weak back and you have been finding it difficult to do your regular activities. Or you could be an athlete who is probably playing for a club, planning to go pro, and you want to meet a physical therapist, and you need to start before start to train a lot harder and you get into injuries. Or you're somebody who's a beginner runner, you have not had any injuries so far, but you want to improve your performance, because it's really not just about the pain. It's about how magically people are getting faster. They're improving their performance. The man has only gotten faster. Like, we have people running a 2 hour 1 minute marathon now, and that's all happened because of insane strength and conditioning, without really waiting for an injury to happen, like starting from day one. So if people have access to physical therapists the same way that they have access to dentists, before you have tooth pain, you go there, you get your teeth cleaning done, you check it, and then before you have a fat bill of probably like a root canal coming up, you can sort things out.
Yeah.
The same thing should happen while meeting a physical therapist. Even if you don't have pain, you get your entire history taking, get your medical things checked up. Maybe you have had a surgery in the past that you needed to get better from. Maybe your rehab was not done at that time. It's not giving you pain right now, but the minute you start with strength training, it's going to start giving a problem. So getting a complete checkup, a musculoskeletal assessment, a fitness assessment, these are very important, because then you will be first aware about what is there in the body and what needs to be taken care of. We will be able to pick up on weak muscles, certain things not working very well biomechanically, which may or may not give pain in the future, and things you need to focus on. You take that plan, you go to your strength trainer, and then you start with that plan, and you're already on your way to recovery from anything that you would have had in the future. So it's just like a very efficient, like time efficient, cost effective way of looking at injury. You have a positive relationship, you know what's wrong with your body, and you can start your uh, exercise training, and you probably won't need any physical therapy after that. So this is just a great way to get started. And I actually get a lot of my clients, currently only athletes are doing it, because they realize how important it is to not get injured during their training cycle, because it's a horrible thing for them to be like on the stand when everybody is playing, and there's also like clubs and like money involved, and their future is at risk. So they understand it better, but regular people should want to understand it, because like the same as an ECG costs less than having a heart attack. A musculoskeletal assessment or one visit to a physical therapist will cost a lot less than having a terrible injury and being bedridden for many, many days. So I think that's something we need to focus on for sure.
We live in such a world that we've been so busy, we've been just hustling, and we are neglecting our bodies to another level. And it's so sad to see that something that only has pros, no cons, is
Correct.
being neglected. Like, that's you
Yeah.
physically just doing activities, and you just physically being prepared to stay fit. And people are not, you have to convince people, you have to tell people, hey, like,
Mm.
that this is good for you and you should just start doing it. It's sad sometimes to see that, but I'm also so happy to see that a lot of people are changing their opinion about physical therapy in general, because PT it's a very new field. There's been fitness, but physical therapy as a field is very new, and
Yeah.
it's so upcoming, it's so expanding, that I love to see that we're taking steps and we're in every aspect, and people are understanding more and more about physical therapy. Definitely.
Yeah. Absolutely. Yeah. So which is why I think prehab will take off in a couple of years, when people realize, and people have already started to realize how expensive it is to go and meet a doctor and get everything done after they are injured. So a lot of people have started to adopt rehab techniques. And I do have clients, who are not athletes coming up to me and asking for a musculoskeletal assessment done because maybe they are going to up their training, they are going into a training program, they're going to be lifting heavier, or they're going to be like, just want to
Yeah.
start running. So I think there is a change coming slowly.
I want to know what inspired and got you in this field.
Oh. Um, so I knew that I wanted to be a doctor for a very long time since I was in seventh or eighth standard. And then it was really about what would I want to be
Mhm.
in. And I think after a while, I just found it extremely exciting to be in ortho, because seeing athletes, I remember like my dad used to watch football, and I would keep seeing these players get injured, and then, their physical therapists coming on field and taking care of them, and then fixing them and sending them back to the field. And I was like amazed how they were not just treating them like in that, like short period of time, but they were getting them back to field, they were improving their performance. And I was like, this is so miraculous. And I mean, I just understood it. Like, biomechanics came very easy for me because it was like the most logical science out of like probably all of the subjects that I read. Like it was just, anatomy, like it'll just click easily.
Yeah.
So I also realized that it was something that I was very excited to do. And even today, when people come to me with injuries, it's still like I'm not saying that I'm very happy that they're coming to me with injuries, but it's still very exciting to find out what ails them and to help them find the right way to go. I've also realized that I will like I'll fail, but this is probably the only medicine for them that is not going to give them any side effects. As you just said, there are only pros of doing exercise. You don't have chance of, getting admitted in the hospital, no post-op complications, no post-op infections, nothing. You are going to be like, you can only get better with exercise. There is no con
Right.
there. And it's just been a fascinating field. I see people excel, do these amazing
Right.
things as athletes. I think they are the most motivated people that I've ever worked with. They drive me rather than me driving them. And I've stayed up at night figuring out, how do I take care of this condition? It's only gotten more interesting. I think we have very exciting years up ahead coming for sports medicine. It's still it's a science in very nascent stage, but we have people who have understood the importance of this, and I'm really excited what's going to happen in the field, like including the research, as well as people's adaptation of this as a core treatment technique, the first line of treatment, rather than being something that you do after surgery. And I have full faith because I've never seen any treatment like this, which is mostly absolutely free, that you're doing exercise and you're just getting better and like there's no side effect. So I think in this, like, is science itself, it is fascinating how something that costs almost nothing can get you better.
Yeah, I can see the excitement while you're talking about it. It's so much joy to see you. Like you said, it's only gone deeper. The love for this field has only gone deeper because when I came here, I started to practice in New York. There were a few things that I liked, a few things that I didn't like. And New York can be very overwhelming because it's so drastic, it's such a big change. So
Mm.
I was just adjusting to the fact. I've been working for this company for almost a year and a half, and a few weeks back I texted the CEO of our company, the owner. She's very sweet. She's a sweetheart. She's like a mentor to me. She's a very good close friend. So I texted her, it's been more than a year and a half, and I don't feel like my love for it has reduced in any way, because I was always scared, how am I going to do a 9 to 5 job? I come from business families, and I've always been like a person who wants to have my own setup someday. And I was amazed that it's been a year and a half at this very place where I have seen these people for almost a year, and I would not change it for anything. Like I texted her and she's like, I cannot believe like you saying that, because she's seen so many PTs drop out because they don't love what they're doing, or they don't find that joy, that the joy that I saw today while talking to you. So that's very rare, and I'm so glad that you found that joy and you're just falling more and more in love with the field.
Yeah, yeah. It's you need to find that joy.
Yeah,
Otherwise, it's very hard to be in the field. I mean, if people are coming in it for money, like definitely don't. There's a lot of hard work involved, and ultimately, you need to love your patients. If you love them, it's going to keep you motivated. And at the end of the day, when they get back to you with how amazing their treatment has been, and they are able to do something which they have never been able to do before, or they haven't been able to do it for many years, and they tell me like, thank you, like it's like it's magic, all of that. And I think that is what you wait for at the end of the day. That's your take home more than the money that you make in this. Yeah.
I agree with you 100%. Tell me, what are your plans and goals for this coming year?
Oh, so my goals for this coming year, they're actually too many. But
Like that.
number one is like definitely I've been working online for a while. So I'm looking forward to setting up a hybrid sort of work where I can see clients in person as well, because I've always loved doing it. And I get a lot of energy when I meet people, and I've kind of missed it a little bit. So I'm seeing how I can help both kind of people, like people who want to meet in person as well as people who want to see online. That's on my more like my personal work front. And secondly, I have also taken up to help and to educate a lot of graduates who come out in India, and they are always telling me that, okay, there's no scope, there's nothing to do, and all of that. So um, I have taken up guiding a lot of physios like that. I do that on LinkedIn. I, prep like small, group meets online currently. But I want to do that more often so that people find the joy, like why you entered, why you sat for your common entrance exam and you got into the field, you studied so much. Because we all had that joy of being a physical therapist, and we've somehow lost it in the way. And I want them to find that joy again. And I want them to realize that you have to be in it, you have to work hard, and you have to study, and you have to be abreast with all of the current evidence, and you need to find your niche in this. You may be good at something in physical therapy, you need to find that. Rather than following everyone, follow that, and you will find your suitable clientele. So I want to help a lot of Indian physios find that, and see that working in India can be absolutely amazing.
Yeah.
So these
You know,
these are my goals.
I take a few seminars for students from India who are willing to come and get their masters done in the US, start practicing in New York. So I've taken like a few seminars now, and I always come across students that are so doubtful about this very field because it's not too well known till
Yeah.
till it's still people don't know about physiotherapy and physical therapy, what it is all about. So I love taking seminars, and if I find students who are there in India, I am for sure going to refer them to you so you can speak with them. You're in India, you can connect with them on a one-on-one level without the time zone interrupting. But it's awesome. It's I'm so glad that you told me about it. Now I can refer you those students, and they can find some comfort talking to you because you this field for so long, and your joy is so evident that you will definitely get them hyped up about it.
Yeah, and along with this, of course, it's not just about getting physios really excited about it. I also want people, especially in India, to know more about physical therapy, because it's nowhere near as close as the position that it has in the UK and US. In fact, a lot of the clients that I take care of right now are NRIs from the US, the UK, Hong Kong, UAE. because they kind of realize the importance of physical therapy. But I have very few clients that I'm taking care of who are actually from India. A few of them are doctors, and maybe that's why they know so much about the field. And I want to spread awareness, which is why I started content creation about 2 years ago. And I want to continue growing there. It's not about me growing for like my personal benefit, but if people get to know how physiotherapy can help you, and you can use it for anything. You don't need to pop pills. You don't need to fall sick because of that. Don't need to damage your liver. You can just do your exercises for your shoulder pain, neck pain, for your performance in your run, everything. You can like get it from a physical therapist. So I just want to grow that in India because we are still not given our due respect. And I hope that if more and more people can be aware of what physical therapists are actually capable of doing in India, uh, then they would come more to physical therapists than any other.
You're on the right track. The content creation, I wanted to create a society, a community of therapists, of doctors, and healthcare people where you can come and talk about health, which is why I took, like, it was just a thought, but I wanted to create a community. And it's been going so good that I love the fact that, you mentioned the awareness. The major thing about this podcast, about today's session, is awareness of what's right, what's wrong for people, and through experts. So you are an expert in the field, and this platform is perfect to talk about what's right, why physical therapy is opted, why we should do prehab. I didn't know so many things about prehab, and how telehealth is coming up in so many states in India. So it's very exciting to know all that. And I love the fact that you're also working on your social media, on that content part. And I'm gonna tell you right now, we're gonna do a few collabs together. This is not done.
Sure, absolutely.
Honestly, more
Absolutely.
with you. There are very few people that I find that are really driven, honestly driven to this field. So um we're on it. Definitely. We have to talk about it after. But yeah, sounds good.
Absolutely.
What are last few words that you'd like to tell all of the audience out here?
I think the last few words that I'd like to tell is something that I tell a lot of my
Mm-hmm.
clients day in and day out. I keep telling them movement is medicine.
Right.
Uh, People don't accept it. I think 90% of the population in India still don't realize that something as easy as exercise can heal their pain, cure them, make them better, make them feel better. Small part of the and exercising. And I want to know that movement can truly heal, okay? And there's no one kind of movement, anything can work for you. You can go into strength training, you can go into yoga, you can go into, running, you can go into swimming. Any kind of movement will help you. The problem is that don't move enough, and then they have injuries, and then there are certain doctors and who tell them not to move at all, like don't squat, don't sit, don't stand. And that's like it's so absurd, because how are you supposed to live if you don't squat? I mean, you can't sit on your sofa, you can't sit on the pot. It's stupid. So I would actually want people to know that when you are told that you should not be moving at all, this is probably when you should be moving. Your body craves movement. We were built that way, and things start to go wrong if we are not active on a regular basis. Muscles use, they kind of lose their ability to do things. So use movement uh, as your medicine. Yeah, I think I lost you there for a bit.
Oh, I'm
Sorry.
sorry.
um,
Is it good now?
Bhavna, are you there?
Yes, I can hear you.
Yeah, sorry. Yeah, sorry. I think I lost you there for a bit.
Okay.
So what I keep telling my clients day in and day out, even my friends, I think they're tired of listening to it. It's like movement is medicine. Make sure that you get some every single day, and there's going to be a very less chance that you're going to have any injury. And even if you have pain, even in cases of acute pain, do a mobility that joint through full range of movement. Working on it somehow actually reduces your recovery time. It fastens the healing process, gets you back to all of your activities a lot faster. So it's, time and money efficient is what I could say. So try movement. It's free, or at least it's cheap. It's much cheaper than a lot of medications. And
And
yeah,
no side
that's what I would like to tell people.
Yeah, I love that. Thank you so much for today's session. I'm gonna
Thank
uh,
you.
I'm gonna tag you so people can find you if they want to reach out to you. She's one of the purest people that I've met, and I love the fact that you were so kind to me when I reached out. I'm very sure if you guys reach out to her, she'll be more than happy to help you through all of your questions. So I'm going to leave all your info in the description. But yeah, thank you so much. So lovely talking to you through this
Yeah, thank
session.
you so much for having me on the show, Bhavna. It's really nice. I mean, that we are able to connect, across, I don't know, like how much distance, and we are able to talk about this and uh, build awareness in the world about physical therapy and about how amazing it is and how it can help people.
Yeah.
So I'm really honored to be on your show.
Yeah, likewise. Thank you. I'm honored to have you on my show. Well, have a lovely
Thank you.
day, and I will text you and we need to discuss more.
Yeah, sure,
In the
sure. You too.
beginning.
Yeah, you too. Have a great
You
day.
too. Bye bye. Take care.
Bye bye.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.